pull up my notes over here. There we go. All right, so a little bit about myself before we get started. Originally, I'm from Pennsylvania, now based in Phoenix, Arizona, but I work domestically and internationally with clients in 40 states and 5 countries. I work a lot with the state of Ohio and the state of Washington the most, so we're going to be talking about the state of Ohio today and what it looks like under the governor's reopening plan for the state of Ohio. A little background on me. I've been working in safety and industrial hygiene since 2013. I was an intern at Zachary Engineering. Then I worked for Marathon Petroleum out of Findlay, Ohio. Went into pipeline construction, health and safety coordinator there, and now I am a safety and risk management consultant for Careworks Comp, as well as a subject matter expert on fall protection, confined space, and rescue and body recovery training for MSA, the safety company. A little disclaimer before we get started. I'm not a lawyer. Any information provided in this presentation is not legal advice. It is just content materials that are available for general informational and educational purposes only. This may not be the most up-to-date legal or other information, though I did just go back yesterday to make sure I had the most up-to-date information possible, though this stuff is changing every week as we move forward and learn more. No reader, user, or browser of this information should act or refrain from acting on the basis of information in this presentation without first seeking legal advice from the counsel in the relevant jurisdiction. So we'll start by the reopening schedule. Beginning on the dates listed below, businesses may reopen if they can meet the mandatory safety requirements, which we'll talk about later, for customers and employees. What I'm going to list first is the businesses that have already opened back up. Okay, that's going to be all health providers and procedures that do not require an overnight stay in a hospital. Dentists, veterinarians, manufacturing, distribution, and construction were all open together. General office environments have reopened. Consumer and retail services. Personal care services to include hair and nail salons, barbershops, tattoo, massage, and piercing parlors. Restaurants and bars are now open for dine-in service as well as takeout. Gyms and fitness centers. Adult and youth sport leagues, non-contact only and limited contact, so no soccer, no lacrosse, no hockey, no anything like that yet. Public and club pools under certain conditions. The Bureau of Motor Vehicles, child care, and day camps, as well as banquet centers. And then some things that have not opened yet but are going to open soon, beginning June 10th, or actually these just opened last week. So the most recent openings opened on June 10th. Those were aquariums, art galleries, country clubs, ice rinks, indoor entertainment centers, indoor sports facilities, again non-contact only, laser tag, movie theaters, museums, playgrounds, public rec centers have reopened, roller skating rinks, social clubs, trampoline parks, and zoos. Those all reopened on the 10th. And then some things that haven't reopened yet but are set to reopen soon by the 19th are going to be casinos, amusement parks, and water parks. And then advisory groups that do not yet have a reopening date, there are still a few of those lingering around. As of yesterday, what I could find that do not have reopening dates yet are going to be K through 12 schools, adult daycare and senior services, rooming and boarding houses, and as well as workers' camps for those, auditoriums, stadiums, arenas, parades, fairs, festivals, though county fairs have been permitted, but most of them are canceling voluntarily. Spectator sports, tournaments, organized rec league sports, but skills training is permitted for those sports. And then some public and private pools. So I mentioned earlier public pools and club pools, as long as they're regulated by local health departments, they're allowed to open. And also use of swimming pools in single households is permitted. Okay, so real quick, I noticed that I do not have pulled up the chat box. Let me get that pulled up. There's a chat box beside the video. For some of you, if you're on a phone, it may be below the video, but if you type in that chat box, I am able to see that. So if you have any questions or anything, you can type those over there. And I usually, every couple minutes, will stop to read through those and see if there's anything that I need to cover. All right, so let's talk about the COVID-19 responsible protocols. We're going to list 5 protocols here that apply to all businesses that are currently open or will be opening soon. Again, almost everything is open or opening on the 19th. There's just those very few that are remaining closed for the indefinite future, still awaiting reopening dates. Okay, so the 5 protocols that everybody needs to follow. Face coverings are going to be required for employees and recommended for clients and customers. So your customers do not have to wear them unless your business chooses to make that a policy. But as far as the mandates go, they're only required for employees but recommended for clients and customers. You need to conduct daily health assessments and determine if your employees are fit for duty, and those can be self-evaluations. We'll talk about that later. You want to maintain good hygiene at all times through hand washing and social distancing. And we're going to make sure we clean and sanitize workplaces throughout the day and at the close of business or between shifts. That's going to be one of your biggest differences from maybe your old business patterns to your new ones, is there's going to be a lot more cleaning of the facility. So any downtime that your employees may have had in the past can be used for that throughout the day, and then save a little time at the end of a shift. Be aware that you're going to have to clean at the end of a shift as well, or at the end of business day. And limit capacity to meet social distancing guidelines. We don't want storefronts or waiting lobbies to be packed full of people. So if you have a waiting lobby, recommend that folks continue to wait in their vehicles, and they can call when they arrive, and then you can call them back when you're ready for them to come inside, is one way to manage that. If you've got a lobby that people have to wait in, rather than having them in that lobby, have them wait in their cars and call them in when you're ready. Make sure you establish your maximum capacity and use appointment setting where possible to limit congestion. Maybe in the past you didn't have appointments, you just had walk-ins. You could change your policy to make it by appointment only to start reducing that congestion, but still maintaining your business. And the following actions need to be taken if you have an employee or customer report an infection. Immediately report those employee or customer infections to the local health district. So if you have a customer call in, if you're a hair salon, you cut their hair last week, they tested positive this week, you're going to want to report that to your local health authorities, and they will handle the contact tracing or assist you with contact tracing for the folks that may have come to your facility after that person had been there. Work with local health department to identify potentially exposed individuals. Again, that's that contact tracing they're going to help you with. Make sure you shut down your facility for deep cleaning if possible. Professionally clean and sanitize that site or location, and reopen in consultation with the local health department. Again, the local health officials are going to be there to help you through that process. All right, so that's those 2 slides. I'm going to go back and show you the first one again. So these 5 protocols right here, as well as this information right here for what to do if an infection is identified, those are required for every employer that is open. Moving on to the next couple sets of slides, what we're going to get into is specific requirements for a few sectors. There's actually a website that has these on it for the state of Ohio. So we're going to go through the sector specific. These aren't going to apply to everybody. It'll say at the top of the slide who it applies to. And once we get to the end of those sector specific requirements, then I'm going to jump into the best practices that everybody can be using, and I say should be using. It's not legally required, but it's going to help you meet those original 5 protocols. So for those sector-specific requirements, we'll start with manufacturing, distribution, and construction. What's mandatory for your employees, your distributors, and your guests is that you ensure a minimum of 6 feet between people. If not possible, you should install barriers in areas where you're going to have an employee kind of static in a location and other people moving around them. Face coverings are required for employees and distributors unless not advisable by a healthcare professional. That also applies to everybody else. If they, for some medical reason, cannot wear a mask, we recommend that they just work from home, but if that's not possible and they do still want to come in and work, they don't have to wear one if they have a healthcare professional sign off stating that it is less safe for them to wear a face covering. Or unless they also don't have to wear them if it's against documented industry best practices, which I don't really know of any situations where that would apply. Or if they're not permitted by federal or state laws and regulations, again, not really something that's going to apply just about anywhere. So pretty much everyone has to wear a face covering without a doctor's note. And if someone does not wear one, you do have to have written justification for why they are not wearing one. The times that it's not required is if the employee is working by themselves alone in an assigned work area where other employees are not expected to come in close contact with them. So that is going to be the one exception that anybody can use, is if you are working alone in an assigned work area, you do not have to wear one, because again, masks are to protect the other people around us. Is to keep us from spreading it if by chance we are asymptomatic carriers. Or even if we are symptomatic, it can still reduce that spread. Employees must perform a daily symptom assessment. Per the CDC, symptoms are going to include cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, and a new loss of taste or smell. So every day employees should report whether or not they are experiencing any of those symptoms, which again are cough, shortness of breath, difficulty breathing, fever, chills, muscle pain, sore throat, and new loss of taste or smell. You need to require employees to stay home if they're symptomatic, require regular hand washing, stagger or limit arrivals of employees and guests, and personnel should work from home if possible. Again, these are specific requirements for manufacturing, distribution, and construction. Even if you're not in those industries, these can actually serve as best practices for you as well. Additional best practices, face coverings are recommended for everybody, including your guests, but again, they're not required for guests. Provide a stipend to employees for private transportation. So a lot of manufacturers, large businesses, folks carpool to get to those. I know my parents do that. They work for manufacturers in Southwest Pennsylvania. They're essential workers, and one of the requirements for their business is that they're no longer allowed to carpool until this coronavirus thing passes, because they know that workers will have their kids in those vehicles, and so you have a lot more chance of exposure or of some contamination getting in that vehicle when your whole family's using it, and then you have your coworkers get in it. And the last thing you want as a business is for 5 or 6 of your workers to all get sick just because they rode in the same vehicle together. That's very close space to have a bunch of people in. If they are still carpooling, again, you can allow that. That's fine, but encourage them to wear those masks while they're carpooling as well. Okay. Daily symptom assessments should include taking your temperature with a thermometer and monitoring for fever. Also watch for coughing or trouble breathing. That note is right out of the sector-specific recommendations. Some shift pattern recommendations for these manufacturing, distribution, and construction companies include daily disinfection of desks and workstations, changing our shift patterns. For example, maybe we want to move to fewer shifts. Stagger lunch and break times so that we don't have all our employees sitting in the same area at the same time on a break, because oftentimes during those breaks and lunches when they're going to have those masks off as well so that they can eat. So we want to stagger those lunch and break times so that everyone's not there all at once. Another recommendation is to split into smaller teams. and limit contact across those teams so that the same groups of people continue to work with each other. That way, if there is an exposure, it's just limited to that group and not spread throughout your entire workplace. Again, that's only going to work in certain business places where you're able to do something like that. And reduce the pace to allow less full-time equivalents per line. So maybe running on a lower production level. Again, those are just recommended best practices. For physical spaces and workstations, it's mandatory that you ensure 6-foot minimum between people. If that's not possible, again, install barriers. Daily deep disinfection of high contact surfaces. So if you have a kind of communal keyboard that's used to run a machine or something, that is going to be an example of a high contact surface that is constantly being touched. Space out your factory floor to allow for that social distancing of 6 feet. Where it's not possible, they need to have barriers between them. Regulate the maximum number of people in cafeterias and common spaces. I already kind of mentioned that one by staggering our shifts or our breaks. Establish a maximum capacity, for example, 50% of fire code. So that's again why it's a recommendation to limit production, is to reduce the amount of people needed to reduce that capacity. Recommended best practices: close cafeteria and gathering spaces if possible, or conduct regular cleanings of those areas. Again, a daily deep disinfection of entire facility. For confirmed cases, you need to immediately isolate and seek medical care for any of those individuals who develop symptoms while they're at work. Contact the local health district about suspected cases or exposures so that they can assist you with contact tracing. Shut down the shop floor for deep sand if possible. And work with your local health department to identify those potentially affected or exposed individuals to help facilitate effective contact tracing and notifications. Once testing is readily available, test all suspected infections or exposure, which at this point, we're now at that point where testing is readily available. So we should be able to test all of those suspected exposures. And then after that testing of the folks in your workplace, again, make sure you contact that local health department to do the follow-up and more contact tracing. All right, that's it for the requirements and recommended best practices from the state for manufacturing, distribution, and construction. Again, those were all directly from the state. For general office environments, this is also, again, directly from the state, and I'm going to have additional best practices that are from me that I've put together from a bunch of resources online at the end of this presentation. General office environments for your employees and guests, you again need to ensure that 6-foot distancing, install barriers, face coverings again required for all employees, and pretty much unless you have a doctor's note, that's about the only way you're getting out of that, unless those employees are working alone in an enclosed office space. For example, you have cubicles that extend, the walls are higher than that person's head. If that wall between the cubicles is not lower than that person's head, then it's not a barrier. But if it's higher than that person's head when they're sitting down and working, they do not need to wear a face mask when they're in their own cubicle or their own office. Personnel should work from home whenever possible and feasible with business operations. Again, my company's not even planning on putting us back in the office until September. That's fine. If they can continue to work from home, the state does encourage you to do that. And again, employees that are coming into the workplace or coming into the office do need to perform that daily symptom assessment. Require employees to stay home if they're symptomatic, require regular hand washing, and reduce sharing of work materials, for example, staplers and things like that. We want to reduce that sharing, and if we are sharing them, keep a little spray bottle of sanitizer or some bleach wipes nearby. That way it can be wiped down before and after use if there is shared work materials. And limit travel as much as possible. So if your workers often go out to visit clients, if we can switch that over to remote visits via video conference, that's better than going and meeting in person whenever that's possible. And stagger arrival of all employees and guests. So maybe have your employees show up a little bit earlier. Maybe let's say you have 100 employees. Maybe set it up so that every 10 minutes there's a group of 10 that's supposed to come in, and you can stagger that and rotate that. And post signage on health safety guidelines in common areas. So taking this information that I'm giving you, going to the state's coronavirus website and printing out those safety guidelines and posting those in common areas. And again, those daily symptom assessments should include taking temperatures with a thermometer and monitoring fever, and also watching for coughing or trouble breathing. Recommended best practices for those general office environments: again, ensure seating distance of 6 feet or more. Face coverings are recommended for all customers and guests, not required but recommended. Enable natural workplace ventilation, so if we can open windows, jack up the HVAC a little bit, get the air moving. Have a health questionnaire for symptoms at the entry for your guests as well as your employees. A temperature taking protocol, so maybe if you have a touchless thermometer, if you have someone up front at the front desk who can handle taking temperatures, that's good and recommended. For your physical spaces and workstations, mandatory frequent disinfection of desks, workstations, and high contact surfaces, daily disinfection of your common areas, cancel and postpone in-person events when social distancing guidelines cannot be met. No buffets are permitted in cafeterias. Utilize disposable tableware and other materials rather than reusables. Establish maximum capacity, for example, 50% of the fire code. They're not mandating you set it at 50%, but they want you to establish that maximum capacity so that you have a number that you're dedicated to not exceed. Recommended best practices for those workstation areas: redesign them so that there's 6 feet or more distancing. Often you can rearrange those. If you have cubicles, making sure they're tall enough that they act as barriers, then you don't have to worry about the 6 feet if there is a barrier. Close your cafeterias and other gathering spaces if possible, or conduct regular cleanings. Limit congregation in office spaces, so the little impromptu office meetings where 3 people show up in a cubicle just to talk, limit that. We want to avoid that when possible. Divide your essential staff into groups and establish rotating shifts. And make sure you have an availability of at least 3 weeks of cleaning supplies, because again, there's been a strain on our supply and distribution chains. So make sure you order that in advance. Keep your cleaning supplies well stocked in advance, because there could be a period where it becomes hard to get again. And with your confirmed cases, again, this is the same as we saw before. We are going to immediately isolate and seek medical care for anyone who displays symptoms, and contact the local health department. And again, we're going to work with them to perform our contact tracing and follow-up testing. So that's the same as what we saw for manufacturing and distribution and construction. Okay, and I believe this is my last sector-specific set of requirements. After that, we'll get into my recommendations for everybody. Consumer and retail services is going to be what the following is for. Again, we're going to have that 6 feet between people. If not possible, install barriers. Barriers are great at your checkout areas. When you put the barrier in at the checkout area, what we're concerned about is when folks are speaking back and forth or coughing or sneezing, that barrier is going to stop it from getting to your employee, or from your employee's germs getting over to the customer. There's still going to be a spot for you to pass. I'm sorry, my dogs just came out of the bedroom. There is still going to be a spot for you cut out to pass money or cards back and forth underneath. Again, our employees need to remember that once they touch those things, there could be contaminated materials on those, so they should not then be touching their face after. And if they do need to touch their face or do anything else, they should wash their hands before doing that. Some employees may be wearing gloves while handling money and things like that as well. Again, gloves are only as good as the person wearing them, so if you touch something with gloves and they're contaminated, then you touch your face with those gloves on. Again, we just defeated the purpose. Okay, so out of that rabbit hole and back to the rules. Face coverings are required for employees and distributors unless they are not advisable by a healthcare professional. We've seen that for the last two sectors as well. Again, not required when working alone in an assigned work area. So if you have someone maybe that works in repairing garments, so most of your employees may be interacting with the public, but the person in the back that's repairing garments or cleaning jewelry or something like that, working by themselves, they do not need to wear a face covering if they're working by themselves. Businesses, again, need to provide written justification for anyone who's not wearing a mask. And that example would be pretty much limited to when you have a doctor that says their lungs are unable to support wearing a mask, or they have some other underlying condition that makes wearing a mask dangerous for them. Okay, and this is something we haven't seen for the other sectors. So the consumer retail services has a lot more interaction with the public. Your customers are all coming inside. You must allow them to wear a facial covering if they want to. So one thing I've seen in Pennsylvania is there were a handful of businesses that put signs up that said no one is allowed inside if they're wearing a mask. For some reason, that's one of the rebellious things some business owners want to do because they feel kind of attacked by some of the rules that were in place that are limiting the amount of business they can do. That is actually illegal in the state of Ohio. You are not allowed to tell a customer that they cannot wear a facial covering. I do know that some folks are concerned that that may increase crime because it makes it harder to identify folks. It's what the law is right now. I don't think it's going to have that much of an effect on it. Again, if you do experience an event of crime, report it to the local authorities, have it be investigated, and if that does become a trend, I'm sure we're going to see about it on TV, and that rule may change, but I don't believe we're going to see much of an issue with that. So again, you have to allow people to wear masks if they choose to, and your employees are required to wear masks except the few exceptions we mentioned. Again, we want those employees performing a daily symptom assessment and have to stay home if they're symptomatic, and we must require regular hand washing. What I would recommend is anytime your employee has some downtime and they're going near the restroom or near somewhere where they can wash their hand, to wash their hands, and also set out some hand sanitizer stations in high contact areas like your entrances and exits. That way folks can use those when they go in and out, and also any other areas where folks are touching a lot of things, maybe by your aisles, your freezer aisles if you're a grocery store, because folks are going to be opening and closing those doors. And clean high-touch items after each use, for example, carts and baskets. As your cart corrallers go out and round those carts up and bring them back, they should wipe down the touch areas on those, which are going to include the handle that folks hold on those carts, as well as I recommend wiping down the sides, like the top part, the whole way around, because some folks will kind of pull their buggy behind them and things like that. Recommended best practice, group employees by shift to reduce exposure. So if you normally just kind of have a random assembly of shifts, try to schedule the same people together on a regular basis so that you have less crossover, less chance of, if there is an infection, of it crossing between your employees. It'll kind of be limited to just one group of employees. And again, that's not possible for everybody, but if it's possible for you, we recommend you do that. For your customers and guests, you do have to ensure 6 feet minimum between people. Again, we can't force people to do anything really, so your customers are going to violate that rule quite often. So what you need to do is have your employees in a position where they can gently encourage the public to follow those rules. And ways that we can do that passively would be having one door set for entry, one door set for exit, having those aisles marked so that people only go one way up or down aisles. Again, are people going to violate those rules? Yes. At a minimum, you should be encouraging them to follow those rules, posting signs, but we're not going to be able to control everyone who comes in and out, so we need to do our best to encourage them to follow those rules and explain why we're following those rules. We should specify hours for at-risk populations. So if you open at 7 a.m., what a lot of employers or what a lot of businesses are doing is having the first hour that they're open limited to the elderly or the immunocompromised, and also some folks are having an hour for first responders as well. So that's something to think about. But at a minimum, the state is requiring you to have a specific hours for that are limited to only the at-risk populations like the elderly or those with underlying health conditions to come in. It's hard to enforce those. Again, with the elderly, I'm sure you could check ID, but we can't be asking people what's your condition that you're an at-risk population. So just kind of putting signs up, and you got to let people be people, and just hope that folks follow the honor code and allow that first hour to be for those at-risk populations. Some stores are even to avoid having that crossover and folks just kind of disobeying that honor code, is they are actually opening an hour early. So if they open at 7 a.m. normally, they will open at 6 a.m. for those at-risk populations. That way the folks who normally come in at 7 a.m. don't get all in a tizzy that they can't get in at their normal time. So those are different ways to handle that. Place, again, hand sanitizers in your high contact locations. Ask customers and guests not to enter if symptomatic. Have signs up encouraging guests to wear masks, especially if they're symptomatic. Stagger the entry of customers and guests. Again, we recommend you run off a limited capacity. What some stores are doing is they'll allow so many folks in, and then as folks come out, they'll allow more groups of people in to maintain that capacity. I'm not sure what the situation is on the ground in Ohio right now. I know in Arizona, where I'm at right now, we had a lot of long lines outside of businesses because they wouldn't let people in large amounts, and they had them socially distanced in lines. That lasted about a week until people got over the panic and the I gotta go and buy everything all at once type deal. And now they're still enforcing those limited amounts of capacity, but I'm not seeing the lines outside anymore because not everybody is rushing to the store first thing in the morning every day now. So I'm not sure where Ohio's at right now with that on the ground curve, but after the first week or two of that limited capacity, that seems to start to go down. Recommended best practices, again, face coverings are recommended while shopping or visiting. Health questionnaire for symptoms at the entry point. Provide face coverings upon entry. That's recommended, not required. Where possible, accept customers by appointment only. And increase availability for curbside pickup. That's one thing we've seen a huge increase for demand for, is curbside pickup and delivery of groceries and other items. Even some department stores are offering that now. And consider suspending your return policies. Physical spaces, ensure the distancing, post social distancing signage, disinfect those high contact surfaces hourly. Consumer retail services, that's a mandatory requirement, is to disinfect high contact surfaces hourly. That's going to be your cash register areas for the most part. Every hour having folks go and wipe down any doors that are commonly open to access items such as the refrigerators and the coolers. And then your pin pads, which I have a whole slide on how to disinfect those pin pads without breaking them and how to make it easier. That'll be coming up in a little bit here. Clean merchandise before stocking if possible. Establish maximum capacity. Again, they use an example of 50% of the fire code. They just want you to establish that maximum capacity. Discontinue self-service food stations and product samples. Food courts need to remain closed at malls and places like that. Recommended best practices, close once a week for a deep cleaning. Again, that's a recommendation, not a requirement. Maximize your available checkout space to promote social distancing. For example, mark spaces or lines on the ground to keep folks 6 feet apart, or use alternate registers. Use contactless payments where possible. Another high frequency area that you're going to have to clean on a regular basis is going to be anything like self-checkout wise. All right, and again, if you have confirmed cases, those are the same requirements we've talked about in all the other groups of employers. Again, you're going to work with the local health department to do contact tracing, make sure everyone's getting tested that was exposed. Okay, and here are the additional best practices that are going to apply to everybody. So these are things that almost anybody can use. For your indoor work areas, move your workstations and queues or your lines further apart. Reduce the number of workstations in use at a given time. Move certain tasks or meetings to times or locations where fewer people are present, or take those tasks and meetings and make them digital. You can meet using phones, laptops, anything else through a web-based meeting application. Make provisions to prevent close contact between workers and others, including the coworkers and the public when transferring items, tools, or materials. For example, you can require one-at-a-time access at designated drop-off or pickup points. You could have folks pull up in the parking lot, call you, and say their order number, and you bring out, maybe you're a hardware store and they ordered a bunch of paint. They called in their order, they paid over the phone with a credit card or online. You go and grab the paint they ordered, take it out, sit it in their truck while they're sitting in the parking lot, and you never actually have to make physical contact with that person. Control the number of people entering the building or office. Again, that was part of our mandatory requirements, was limiting capacities. So establish your max capacity and enforce it. Stagger your work schedules so that your workers aren't crowding when they arrive and leave work. Breaking down your normal shift changes into like maybe 2 different 15-minute increments so that you don't have everybody going in and out, clocking in and out at the same time. If you can go to a mobile clock system so that they can use their phones to clock in and out of work, that's even better. That way there is no crowding around the time clock. Use dividers or floor markers to distinguish appropriate spacing for people waiting in lines or in front of service counters. Designate employees as a physical distance monitor. This is especially helpful for retail. Pick your outgoing employees that really get along with folks, someone winsome, that's really good at staying calm, very customer service oriented, and can speak to people and convince them to kind of follow these social distancing rules as they wait in line and as they walk around the store. For your break areas in your meeting rooms, stagger your break and lunch schedules. We've mentioned that earlier. Limit or monitor occupancy based on the size and layout of the room so that people can stay 6 feet apart. Excuse me, sorry. Hold gatherings in larger spaces or outdoors where workers can readily spread out. When you do something like that, like if you have to have a meeting, for example, we can have a meeting in the parking lot before work starts, have folks stand spread out 6 feet apart in the parking lot, and then you can have your safety meeting out in the parking lot, and you can speak through a bullhorn or something like that to speak to everybody. So kind of gets everyone up and out. It's great for if your company has a stretch and flex program, those of you in manufacturing or construction. Do your stretch and flex if you have an empty open parking lot before the workday starts. Folks can each take a parking space to themselves, and you can do your stretch and flex in the parking lot. Just be aware of any vehicles that may be coming in or out. So again, that's more for like an empty area on a construction site. Already read that one. Set up rooms to facilitate appropriate distancing. For example, provide a limited number of chairs and spread them out. Utilize online meetings and text messaging instead of in-person meetings. So you could check in, your manager could check in with all your employees in the morning via text message. They can send them that survey for symptoms and ask them if they have any of those symptoms. Check in with them via text message. For your mobile work areas or outdoor work areas, Have workers take separate vehicles when passenger space in vans and trucks doesn't allow for social distancing. So some of you may have carpooling going on, or you may have to go from job site to job site, for example, construction, things like that. If they can take separate vehicles, that would be better. But if they are going to be in a vehicle together, again, they should be wearing masks in that vehicle. Reduce in-person visits with clients and customers. Rely on email, text, and online meetings when you can. Pre-arrange with clients and customers to drop off or pick up packages, materials at a location that ensures one at a time access. And if you have to go out and do home visits for service or delivery, or maybe you're a plumber, you got to go out and work in someone's house, contact the client and ask them if they are displaying any symptoms of COVID-19 before you make that house visit. And if they are, you got to determine what your policy is going to allow. Perhaps it means waiting to do service for them if they are symptomatic until they get tested, or you just take extra precautions. You make sure you wear a mask and gloves when you go in, you work on everything, and then you make sure that you wash your hands and decon afterwards when you're leaving. Would be acceptable. OSHA's website has a great guide for home service. It has a flow chart. If you do home service, you go into people's homes to perform work. If you want to shoot me an email, I can get that flow chart and that recommendation over to you if you can't find it from OSHA's website. Set up outdoor work and break areas to accommodate social distancing. For example, ensure those shaded break areas are large enough to allow a minimum of 6 feet between workers. Keep in mind for your smoking areas as well. If you have a smoking, some folks in manufacturing, they'll call them smoke pens, and it's like a caged area where folks are allowed to go smoke. You're going to want to consider making that area larger so that when folks are out smoking on a break, that again they are staying 6 feet apart. Additional best practices for cleaning. Be sure to wash and rinse visible dirt and debris from equipment, tools, and other items before you disinfect them. Cover fabric and rough surfaces with a smooth material so it's easier to clean. For example, you can place a piece of plastic film over your point of sale keypad that makes it easier to wipe down or replace regularly than cleaning the buttons. So this is an example of that. You pull the top guard off of your pin pad, you place a sheet of plastic under it, and then you put that guard back on. And now, so what that does is it makes it easier to clean. It does not actually reduce virus transmission. That's not an antimicrobial plastic or anything like that. It's just easier to spray and clean. It protects the pin pad from the cleaner getting in there and messing anything up. And it also makes it easier to wipe down. You don't have to get down in all them nooks and crannies between the buttons. You just clean that flat piece of plastic. Another thing you could do is just swap the plastic out every hour. Those of you in retail, again, you have to sanitize these high contact areas every hour. You could either swap that plastic out or wipe it down. When it comes to cleaning those point of sale systems, do not spray or pour disinfectant directly on the pin pad or the system. Instead, you should spray the cloth, dampen the cloth with a disinfectant, and then wipe it down. That's whether you have plastic over it or not. By doing that, it keeps you from damaging it. Clean the device with mild soap, pH neutral is best, and water using a dampened microfiber cloth. Disinfect by wiping with 70 to 90% isopropyl alcohol. And take caution not to press hard on displays or pin pads, otherwise you're going to damage those. And employees can use common disinfectants like Clorox wipes on the outside casing. Some businesses, like I said, opt to cover that pin pad with that plastic film. Lewis asks, do workers in the kitchen need to wear masks due to the heat or possible fire hazard of wearing them? Do register workers or cleaners have to wear gloves? Register workers do not have to wear gloves. Cleaners would need to wear gloves if the cleaner would require it, and I would say in most cases when they're cleaning they should be wearing gloves, and that's just to avoid skin irritation due to the cleaner itself. As far as working in a kitchen, workers do have to wear a mask, and that is because they're going to be working in proximity to other workers. That being said, I have not seen anything where it says it's an industry best practice to not wear a mask in the kitchen, but I can look into that. If you want to shoot me an email, I'll look into that and I'll get back to you to see if I can find anything on industry best practices that you could use as a way to get around that. But at this time, I do not believe there's a way around that. Kitchen workers, to my knowledge, should be wearing masks at this time. All right, some additional best practices for identifying and addressing your ill employees. Encourage workers to report concerns and use paid sick leave if applicable. Conduct those daily symptom checks. We already talked about that. And to educate your employees about COVID-19. Regularly communicate important safety messages and updates. Post readable signs prominently throughout the worksite with messages about that social distancing, frequent hand washing, required PPE, respiratory etiquette. In other words, making sure that if they are going to sneeze or cough and they don't have a mask on, that it is going into their elbow. And post relevant information from the Bureau of Workers' Compensation, OSHA, local and state health departments, and the CDC. I have a ton of links down in the description of this video to resources that I've used to put this together. And some of those resources also have printouts, including a really good one from the World Health Organization. Provide ways for workers to express any concerns and ideas to improve safety. And this here is from one of our VOC counselors. She handles return to work for injured employees. She put out a little set of suggestions for how to return to work after a shutdown or decreased production. So your employees have been possibly sitting at home for quite some time, and that can actually have more serious effects than you would think. Employees who have worked decreased hours or not worked in several weeks could be at increased risk of injury due to deconditioning. Some risk factors for deconditioning include fitness level, length of decreased activity, and the reason for decreased activity and age. And studies suggest that the effects of decreased activity can reduce the cardiovascular strength by 25%. And after 3 to 4 weeks of inactivity, so if they, while not working, just went home, sat at home, didn't really do anything around the house or outdoors or exercised, after 3 to 4 weeks of inactivity, their heart rate can increase by 15 beats per minute. And in just 5 days, bone density loss can begin due to decreased activity. So coming back to work, a lot of your employees that have been off may be at higher risk of injury. So to take care of that, we want to make sure we encourage our workers to hydrate by providing easily accessible water coolers or fountains. Again, those are going to be considered a high-touch area. So what would be even better than that would be bottled water at this time. Scheduled walking, work meetings, or walk during breaks or lunches. Again, this is compounded by the fact that COVID-19 is communicable, so they'd have to be spaced out. Allow your employees weekly or daily wellness time in addition to the regularly scheduled breaks, 30 minutes to an hour a week for the first couple weeks that they're back. Implement a company-wide 5 to 10 minute stretching routines at set times, such as the start of shifts or after returning from lunch breaks. Again, that's something that's already common practice in most manufacturing facilities to reduce injuries. Prioritize tasks and set small achievable goals. When you come back to work after being shut down, it's easy to be overwhelmed by the amount of work that didn't get completed during a shutdown. But if you take time to prioritize that work and set daily and weekly goals, we can ease some of the stress of returning to work. Make sure we re-review our ergonomic and safety protocols and policies with staff, such as a return orientation, and you can do that remotely. Again, you can do that just like we're doing this right now. You can broadcast it, you can have a Zoom meeting or some sort of other digital meeting, or send out the policies by email. Make sure you check in with all your employees to discuss any discomfort or issues that they are experiencing, and incorporate task rotation to decrease your worker fatigue. For your physically demanding positions, plan for a gradual return to work schedule. Examples include half or 3/4 shifts for the first week or two, or work 1 to 2 full shifts followed by a day off for the first week or two. Again, these are just best practices. I know they're not going to be possible for every employer to meet. Another thing, you can implement a graduated weight handling plan. Temporarily decrease weights to half the general required work weights. For example, if workers are typically required to lift and carry 50 pounds for the first 1 to 2 weeks, require a max lift and carry of 25 pounds. When folks are stocking shelves, we know we all have that one employee who likes to pick up more than everyone else, when they come back to work, if they haven't been hitting the gym or something and they try to pick up what they used to pick up 3 to 4 weeks ago after being deconditioned, they could end up hurting themselves. So we want to make sure everyone realizes that their limitations that they used to have are likely less than that now that they're coming back after a lot of time off of work. That's the big takeaway from all this. Even if you cannot meet any of these best practices, just notifying your employees, hey, you've been off a while, we want you to not overexert yourself. In other words, if you used to pick up this big thing all by yourself, get help this week until we get back into the routine of things. Here are some more references. Again, I put these references down in the video description, and if they're not there, I'm going to double check after this video and I'll put them there afterwards. You can email me if you need any of these as well. We've got all the stuff from the state right here. Sector-specific operating requirements. This is one I'm going to click real fast because we only went through a handful of them. If I went through all of them, we would have been here for an entire day. So you should be able to see this sector-specific operating requirements page, the web page I just pulled up. If you go to that link, we have the primary sectors right here. There's obviously a lot here that I didn't go over. So if you're in an assisted living, you just click that assisted living button and a sheet comes up that you can actually print out and hand out to your employees. So those of you that were in manufacturing, that one's in here, and they also have it available in Spanish. So that you can print this out and post it in your workplace. I recommend everybody does that. Restaurants and bars. So we actually had a question about wearing a mask, and I can actually take a look right here, and it does not say anything about your folks in the kitchen not wearing a mask. So I'm taking a look at all that right now. So it was Lewis that had asked that question. I don't see anything here about an exception being allowed for that area. All right. So again, take a look at this website. Every sector that they have specific requirements for has a sheet in here. If you don't see a sheet for your industry, it means that you do not have specific requirements for your industry, and you just have to follow those 5 key protocols that I listed at the very beginning of the presentation. Okay, so again, that's this sector-specific operating requirements link right here, and that should be down in the description. If it's not, I'll update that after the presentation. Additional resources. We've got the CDC. I'm sorry, my dog's itching her collar behind me there, working from home. The CDC's guidances. Right here is the cleaning information, so you'll definitely want to check that out if you haven't already. And when it comes to deep cleaning, if somebody is sick in deep cleaning, we can click right here, and we're going to scroll down to cleaning and disinfecting your building or facility if someone is sick. So right here. That is what we're going to do if we have an employee that is found sick. And that can typically be handled by a professional cleaning service. Lewis just mentioned that he had heard about those masks not being required for kitchen workers in a news conference. Lewis, you mentioned you couldn't find it either. If you do find it, send it to me and I'll email it out to everybody that's in here. I'm going to be, oops, I didn't mean to pull this up. I'm hesitant to recommend or share that information because, like you said, you can't find it and I can't find it online either. But if we do find it, I'll happily share that information if we can find that from either the governor's office or from the state. Until then, you can always call the state as well to find out, but oftentimes they beat around the bush, kind of like I'm doing now, because most of them don't know exactly what's going on at all times either, because so much is changing so quickly. OSHA. OSHA has quite a few publications out that are helpful as well. Again, these are also down in the description. Okay, and then some general references. Here are some more information about returning folks to work after a shutdown, a generic shutdown, in this case a pandemic, as well as 2 seminars for returning folks to work that are free. Those, again, are in the video description as well if you want to check those resources out. And lastly, this webinar was sponsored by the NFIB. I believe that everyone in here is NFIB members. If you're not, employers participating in NFIB-sponsored workers' comp group rating programs have saved over $1 billion in workers' comp premium costs. So if you're not in the group rated program for the state of Ohio, that's also known as Group Retro, where you get a percentage of your premium back as a refund if the group performs well. They've gotten over $1 billion in workers' comp premium costs back for employers in refunds. And employers receive both workers' comp and unemployment compensation claims management and hearing services when they participate in an NFIB group-rated program. Employers receive comprehensive safety services such as audits, newsletters, trainings, webinars like this when participating in those group-rated programs as well. And they receive access to the NFIB Legal Defense Program administered by Bricker and Eckler. To get evaluated for the NFIB Workers' Comp Group Rated Program, follow this link right here, careworksohio.com/statefund/TPA/AC3-form. When adding company information, remember to include NFIB in the association field. You may also request that form be sent to you by contacting Zach Stewart from Careworks, 614-932-1565, or by email, zachary.stewart@careworkscomp.com. For more information or resources, you can also go to nfib.com/ohio/TPA or careworksohio.com/statefundTPA. And again, there's that disclaimer that I'm not a lawyer. What I am doing today is just providing the information that I have assembled by researching all of the releases from both state, federal, and local guidelines. If you have any questions, feel free to email me. That's what I'm here for. I will go way back to the beginning here and pull my contact information back up for you. Also, take a look if you have LinkedIn, linkedin.com/in/John Valentine IH. I will post changes to rules and regulations anytime OSHA has a change. If the BWC comes out with a guidance, anything like that, I will post that information on LinkedIn as an article. So feel free to follow me there on LinkedIn, as well as to email me anytime you have questions, john.valentine@careworkscomp.com. So that's going to conclude it for today. You may see another email in the next couple days about this same presentation, only it's going to be for Careworks, all the rest of Careworks members, and then I'm also doing one for CMI. So if you get another email about reopening Ohio in the next week or two from Careworks, you can disregard that. It's going to be essentially the same presentation. It's just going to be held for some other folks. But NFIB wanted to make sure that their members got their webinar right away. So y'all were the first one, and there will be a couple more as well. So again, if anyone has any questions, pop in the live chat. Other than that, that's going to conclude it for today. I'll monitor that live chat for about 3 more minutes, and if nothing else pops up in there, I'm going to end the stream, and you can still just contact me by email if you have any questions. So thanks again.